Sulick. I'm a senior policy advisor at the National Committee to Preserve Social Security and Medicare. And if you are not familiar with our organization, we were established in 1982 by James Roosevelt, Franklin and Eleanor Roosevelt's son. And our whole mission is to preserve and protect and strengthen social insurance programs. So my comments, I'm going to talk a little bit, very briefly, about, I think, some key points regarding social insurance programs, Social Security, Medicare, a little bit on Medicaid. And then I thought I'd share with you what we see as what's at stake right now and what threats there are in these programs. And then finally, what we're doing as activists and hoping that you'll join us in some messages and some ways that we can go forward to protect the safety net programs. I heard you had a wonderful presentation by Brooke earlier today on Social Security, so I'm not going to spend, I was going to spend some time on that, but I'll just make a few points. And I don't know if you covered this when you were talking earlier, but one of the things we started doing at our organization is somewhere along the line the word entitlement became a bad word. And so we are framing things in terms of earned benefits, because that's what we believe they are. Social Security came out of the payroll, your payroll check, you paid for it, you're not getting something for free, and people aren't freeloading. These are their earned benefits. So we're trying to change the language in that way. As I'm sure you all know, Social Security has been a great, very successful and a great program in terms of reducing poverty in this country, and it still does. Right now, if we did not have Social Security, about 44% of people 65 and older would be in poverty, as opposed to now where it's about 9 to 10%. And what's happening right now, which is frightening to me in the political arena, is they've been using Social Security, some people in Congress, as kind of a bargaining chip. And we do not think that earned benefits should be negotiated away. First of all, Social Security is paid for, and it has not contributed 1 penny to the federal deficit. So we don't even think that we should be tying it into the conversation that we're having with the budget right now. Now, there is a shortfall in future years, and we recognize that. But sometimes in the media, you'll hear that the system is bankrupt, and that's really a myth. There's folks who have never liked this program, don't think it's socialism, and have always wanted to get rid of it. Right now, there is a $2.7 trillion surplus for Social Security. That's about $54 billion more than it was last year. And what will happen is, if nothing is changed, in 2033, the program will be able to pay 77% of benefits. Well, nobody wants a cut, so there is something we want to do to shore that up. But the point we've been trying to get across in our organization is you don't have to hurt beneficiaries and seniors to pay for this. When, as we just heard, there's other more high income and other people that can be picking this up, because people in Social Security rely on it for a major portion of their income. Women and people from communities of color rely on it even more. One of the things that we promote is the idea of raising, sometimes we hear it called scrap the cap. Are you familiar with the cap? Well, it's currently at $113,700. And if you're not, how this works is, if you're paying into the system, once you hit that $113,700, you stop paying taxes. Now, if you make $50 million, or you make $113,700, you're still paying the same tax. And we propose raising that tax. If it was gradually raised even about 2%, you would have 95% of the shortfall covered. And what's interesting is that poll after poll show that Americans of both political major parties, Republicans and Democrats, favor paying a little more into Social Security, because they want the program to be there for themselves and others, but no one seems to be listening to that. It just has become into this, we got to cut, it's not fair, and we think there are other ways to address these issues. Now, I'll move on to Medicare a little bit because that's another issue that is really on the chopping block when it comes to the current budget deficit talks. Medicare provides health insurance to 50 million Americans, 41 million are older adults, and about 9 million are people with disabilities. The program is solvent it's actually extended its solvency to 2026, and then it can pay about 87% of benefits. But what doesn't get mentioned a lot is that since the Affordable Care Act has been put into place, it has increased the solvency, the costs are coming down, and seniors in particular are getting a lot of good benefits. And I think we try to get that message out there because people don't know about this. We hear a lot of things, well, right now the computer system's not good with Obamacare, but is lowering prescription drug prices. People are able to get preventative services with no out-of-pocket costs. And if we continue to let this go and stay in place and bend the curve down, we will see some changes. There is a lot of talk about, well, we need to do things like raise the age to Medicare and sometimes Social Security, or we need to means test it more. And I think what people don't realize is with Medicare, people, I can understand because on one, logically it makes sense. You think it sounds logical, like people are living longer, why shouldn't we just extend the age? But that's not the case for all populations. And when you talk about economic justice and social justice, many people, especially people from communities of color, are not living longer. And if you're 62 and you're in a job where you've been on your feet working and you're just dying to get to that 65 so you have some health care, going to 67 is a problem. You're going to be sicker. You're going to cost the system more money when you finally get into it. And there was just a report that came out this past week in terms of raising the age to Medicare, and they found that it doesn't really save much money. So, and what it does, it will hurt 65 and 66-year-olds who don't yet have care, and it also increased the prices for all the other folks in the health exchanges that they're putting into place. Another point with Medicare that I think is very important to get across when you're doing your advocacy work is there seems to be this perception that older people have a lot of money. Well, and that's not really the case. No, but there is. People say, well, they're going out to Florida, they're all eating at Denny's every day, they're doing, I hear these kind of things. And only 5% of people 65 or older have $85,000 or more. Did you know that over 1/2 of Medicare beneficiaries have incomes less than $22,500? So, and they also pay 3 times more of their income for their health care than younger populations. So there are a lot of costs, plus with traditional Medicare, it doesn't pay for dental, doesn't pay for vision, doesn't pay for hearing, there's co-pays and deductibles. Most people can't afford to pay more. The counter argument, and I'm one of the lobbyists, so I work on healthcare issues, and I hear this when I go into meetings, is, well, seniors need to have more skin in the game. And it's like, what skin? They have enough skin in the game. That means that, if they were paying more, they'd be more careful and use less health care. But it doesn't really make a lot of sense because, first of all, I don't know about for you, but for my mother and grandmother, they're not making their healthcare decisions. Their doctors are telling them, you need this test. And they're not going to argue and say, no, I don't. If they think they need it, they're going to use it. And what happens is, and research has shown this, is people who don't have the health benefits, they either delay or forego care entirely. Yeah. And then they get sicker, and then when they do go in the system, they cost more money. Yeah. So I think, again, that's another major point we're trying to, I'll try to close up here in a second. Sorry, I get very passionate about these issues. And the last point I wanted to talk about is Medicaid. As you all probably know, because you're aware of these issues, but a big part of the American population does not, is that Medicare does not pay for long-term care. And people do not understand that. Medicaid is the primary payer, but to be on Medicaid, you have to spend down your resources and impoverish yourself. And the cost of nursing home care or assisted living is very expensive in this country. The latest I saw that a private room, the average price for a private room per year for a nursing home, close to $90,000 now. If you need a person to come into your house, if you want to stay at home, it's about $21, $22 an hour for that person. So in this country, we really need something. We believe we need some type of social insurance, and maybe a private public system, however we want to do it. But the government needs to have a role in making sure that people don't have to impoverish themselves in this country to get care. And that's something that we've all been working on in our organization. So I have lots more to say, but I'll stop. And I just want to end with Eleanor Roosevelt is one of my favorite people to read about. And one of her quotes, which always sticks with me, is, "Justice cannot be for one side alone, it must be for both." We need to protect low and middle income folks who can't afford this care, who it's a basic right. So I just urge you, when you do your advocacy efforts, that you'll join with us and make the point to lawmakers that they should not be negotiating earned benefits away. It's not okay. There's other ways to handle these problems, and it shouldn't be back on the backs of seniors and low-income people. Thank you.
Thank you all. At this point, we want you to sort of engage with each other. I do have one question, because you've all talked about economic security from a slightly different angle, about how to get some new revenue through tax policy and taxation, how to really enhance the employment so that people have their own economic viability through jobs that pay well, through social supports that are necessary for people in our system. And I wonder if you could talk amongst yourselves or bounce off of each other about how you see those things linking, supporting, being in conflict with each other. Do you end up fighting with each other sometimes, or are you working together to support each other through these different approaches to economic security? Or if there's more we could do to do that.
Well, I think cohesion is a big problem. I mean, as Brenda mentioned, and I think I touched on as well, Americans overwhelmingly support progressive ideas, and yet I think it goes back to where the money is coming from, that it's not necessarily focusing on that. So I think there really needs to be a stronger push from progressive groups to really get together and come together on these issues. Again, FDR and Eleanor Roosevelt, I mean, they were huge proponents of an economic bill of rights, which you all, came together and agreed that needs to be the priority this morning. I will say that Mr. Conyers we went up on Friday to Columbia University. They did a full employment and socioeconomic or equity and wealth conference, and coming out of that conference, they also want to, and that was predominantly pushed by the National Jobs for All Coalition, but they want to resurrect this idea of an economic bill of rights and moving it into the 21st generation, or 21st century rather. So I think if we can get groups to come together and really work to push that message as one big group, then as a whole, that will be a louder voice than the few who are paying for politicians these days.
Actually, something that I just wanted to say about sort of the idea of unity behind it. I just come from a background, I'm working on a lot of different issues. I worked with anti-war veterans, I've done anti-fracking work, anti-casino work, a lot of different things. But what has resonated the most for me about the Robin Hood Tax campaign is this very idea that it's not about, having people in their silos and this sort of struggle that we've been forced into over the last few decades where our pot keeps getting smaller and smaller, and you have this small sliver of society who has all of the money, and the rest of us are fighting for the crumbs. And the thing for me that's really powerful about the Robin Hood Tax campaign as the mechanism with which to shift that is that it's about creating enough revenue in a progressive way so that we're not fighting amongst ourselves, that we actually can, there's enough money in this country right now that everybody could have necessary access to care, education, have a living wage, have a good job, be able to live comfortably in a home. The problem is that the money is not coming to most of us, and but it exists. I think it is really a question of distribution. So I actually really do honestly believe that the Robin Hood Tax campaign is one of the ways to get behind this, because the way the campaign is structured is that you don't have to, a lot of times people come to and are like, support our issue, and you have to stop working on some of the, or you feel like you have to stop working on some of the amazing work you're already doing. But the idea with this is that this is the way with which we can all keep doing our work, but have it connected. Like you can keep working on fighting for Social Security and protecting our earned benefit programs, and all you have to do to make it part of the Robin Hood Tax action is put on a Robin Hood hat. Like that's actually where that imagery is so specific. But I actually, when you look at long-term grassroots tactics, like having that look of unity, of the fact that all of these hundreds and hundreds and hundreds of groups are working together, I think has a really powerful statement in terms of shifting power dynamics. So I think that the Robin Hood Tax campaign can be that mechanism.
I just wanted to add, and I think this is important to your group because you do such a good job at this. When we talk about cohesion, we need to have the generations working together. You'll hear that, well, we have to shore up Social Security for younger generations or Medicare. But when you think about it, who is going to need a foundation of guaranteed benefits? Younger generations may need even more so. As we just heard, people are getting started later in life with their careers. They have huge debts from loans. They're getting their starts later, and which means they get to save less money over their lifetime. And it's not that they shouldn't do this, but there needs to be a foundation. And I think it's very important for people, especially in Capitol Hill, to hear from younger generations, if you can work with younger groups, to say, we care about Social Security and we're okay with maybe raising the cap, or we want our parents and grandparents to have this and we want it there too. So I think in all issues that when you talk about cohesion, I think you need to have the face of all folks on there.
Can I just piggyback on that, because that was actually, you led right into my next question, which was about one of the things that's happening as we've reduced the pie and we're scrambling for crumbs, is that there is this pitting of generations against each other. I have to get mine, you can't have yours, you're taking too much for me. And I wonder if others, I mean, you began that conversation, but if you'd like to comment more on, are there ways that you can see that we can move from this, we have to pit the generations against each other, we're in a fight with each other to address some of the economic issues of our society, whether it's the one you've already spoken to or something else that you'd like to address?
I just wanted to add this idea of the generations pitted against each other. This argument has been around for a long time, and the research shows it's not true. Younger people want to support their families and have the benefits there. Older people don't want to grab everything so there's nothing left for their grandchildren. It's just not true. And you'll see in a lot of the conversations where people are trying to get rid of the programs or maybe privatize them and move away from the public program, that they frame it in terms of this generational equity debate. And it's really not the case. So I think it is very important that you have your grandchildren speak up. I mean, you have activism at younger yours, and again, the Gray Panthers does that. So I think we need to challenge people. I don't think that there's this outrage as much as some of the journalists and media portray.
I would just go off that and say I think people get engaged in different ways too, and it's really a matter of figuring out how people want to be participating and utilizing that so that everyone kind of plays a role. We on the jobs front actually held this past week a youth activist summit where we brought in about 10 of the leading youth organizations to just talk about the overwhelming crisis in youth unemployment. I mean, and they told us, they were like, nobody really seems to be having this conversation on Capitol Hill. So I think there is a lot of opportunity to kind of bring those groups in with some of the more standard and tested and tried and true organizations to get everyone to the table. But I do think that we have to really kind of think about how people like to engage and make sure that we're tapping into that appropriately, because the youth can play a huge role in all of these issues, and they're going to age, so they will become their own issues too. So.
I think the only thing that I would want to say is that something that I hear a lot is, today's youth is so apathetic. What's the problem with today's youth? And that always frustrates me, because I don't know anyone my age who doesn't think there's a problem. They're not apathetic, but they're resigned. And I think that, that's a huge difference. I mean, I know my whole life, which is short, I know that I'm young in this fight, but I've just always lived under the backlash of Reaganomics. My entire life has been under massive deregulation, massive corporatization. I don't have a personal history of being able to see in a public way the impact of social movements and an actually left-leaning government. That has been absent for me. I had to seek it out. And I think that, it is a really different kind of world in that way. I mean, I recognize that, it's different for all generations. And so something that I really, really appreciate is that the Gray Panthers really seek out trying to make those connections, because you recognize that, generational experience isn't just about age, but about experience. I still have no idea what the internet is or what it's going to mean for communication when I'm older. The way we interact as people is so radically different. And I think that, we're still trying to figure it out, those of us who are whatever, the Facebookers and, whatever we do. It's really just changing the way we interact interpersonally and within my age group. And I think it is creating these other larger and larger barriers between other generations in a different way. But so I do think that, I guess just the reason I say that is I appreciate you taking the initiative to not sort of marginalize different age groups and say that, oh, you young people are lazy, we're gonna get you working. But you say, there's something different. How can we engage with you? How can we better learn? And I just encourage you to continue that conversation and continue talking to your colleagues in that way. So thank you.
Just one thing going off of that too. I mean, I think our younger generations, because this is all we've known, see it as my participation, how will it actually have an impact? And I think that there is a huge opportunity from the older generations to educate. I mean, I think unless you really enjoy history, so many people don't look back, and there's so many positive, historical events that we can look at and say the youth had a major impact in this, and it's pushing that on them and making people aware that their one voice does count. And I mean, we only have about 50% of voter participation right now. I mean, I think if you looked back to the founding fathers, they would be aghast at that sort of levels. I mean, we really have to reach out to get people engaged, and and whatever that means. I mean, if that actually means sitting down and talking to them, or whether it means sending emails or some of the Twitter feeds and whatnot. I think there's a lot of opportunity if you think outside of the box.
Okay, thank you. I want to give the audience an opportunity to ask questions and engage with you all now.
So I'm the vice chair of the Gray Panthers National Board. I don't think I've met two of you yet. Brenda, I've known for a while. I've been working as a health and aging policy fellow on the Hill for the past year in Leader Pelosi's office. And one of the things I've seen since the president's budget came out is this aversion from liberals and liberal organizations to saying, yes, we can talk about revenue, because they're afraid that if revenue is put on the table, then Social Security will be too, as part of the president's kind of grand bargain approach. And so I feel like I've seen that on an individual front with other organizations. When Wendell Primus asks, please start talking about revenue so that that's on the table and we can actually, raise revenue instead of just continuing to cut because we're getting to bare bones. So what is your perspective on that from the organization, from the Hill, from the movement to actually start getting those revenues, and how do we get around that?
From our perspective on the Hill, Mr. Conyers, he has been adamant at the forefront of making sure that these programs aren't cut. I think we need to push it back into the national dialogue that we're at the lowest tax levels that we have ever seen. And the Republicans have really been winning this messaging for the past 20, 30 years that, oh, they're taking so much money. And really, back in FDR's time, the top income brackets were 90%. Can you imagine if that was in place today, what we could do? It's just, somehow we have to shift that conversation back to the reality. And you had touched on it earlier, that it's just the paradigm that we're living in right now, but it doesn't have to be for forever. And I think that, we, in our office, we do kind of think it may be bottoming out, or at least we hope it is. But, until we do start to see that swing back, there's got to be a push to make sure that that is part of the conversation.
I think from our organization's point of view, and we work a lot with the other national aging groups, is that we would like to see more revenue on the table. It's just priorities and how you go about getting that. As I mentioned, for example, with Social Security, you could raise the cap. People would be interested in talking about that. When it comes to Medicare, there's been a start on reducing fraud, waste, and abuse. Just in the last 4 years, since the Affordable Care Act was passed, they've saved about $15 billion they have found in fraud with Medicare. We support, that's a lot of money, supporting efforts like that. Another thing that we support is, in terms of Medicare, is there's a bill that Senator Rockefeller has, which would ask drug companies to reinstate the rebates that they pay the government for drugs, meaning that the government would get a rebate for their drugs. This was in place before 2006, but the bottom line is it was scored at $141 billion over 10 years. Pharmaceutical companies don't like this because it hurts their bottom line. But we would say, yes, we agree revenue needs to be on the table, but let's do it in a fair way, and let's make sure that the poor people are not paying for everything.
Okay, we probably have time for just one more question, and Jan? You got one.
First off, want
session,
to
Joan, so.
convey my thanks to Congressman Conyers for always putting the right bills out there. As a constituent, a frustrated constituent of Congressman John Dingell, I would like to ask, what is it that we can do in our districts and our Gray Panthers? We've even protested outside of Dingell's office. What can we do to get more people to sign on to these bills and support your boss?
I do think a lot of the district, lobbying is really powerful. When members see their own constituents in the flesh wanting something and consistently wanting it. Mr. Conyers is the perfect example. Sometimes you just have to continue to bang your head against the wall until you think it's gonna bust. I mean, because there will be that day that the light switch goes on and they actually see the benefit of moving. And you just, I'm an eternal optimist, so I guess that helps. But I think it really, it's got to be a consistent message. It's got to be, you know, strong. If you and then your neighbor and then that person, you know, they put one more person into the office. I mean, the more you get that sort of, you know, constituent conversation asking for the support, I mean, the more likely it is. I know that, you know, you can do that until you're blue in the face, and sometimes members just aren't going to follow, but that would be my strongest advice.